InfiltraLong, for the effective pain treatment of long and deep surgical incisions. Pajunk is one of the world's leading manufacturers of medical systems for the most varied application methods in regional anesthesia, laparoscopy, organ biopsy and dentistry. Again and again, the enterprise has proven itself with outstanding innovations which have revolutionized regional anesthesia. This innovative power is based on decades of experience in the development and production of cannulae and catheters. Wound infiltration is an extremely effective method which is simple to apply for post-operative pain treatment. A local anesthetic is continuously injected by way of a catheter with multiple perforations, which the surgeon places in the incision. It blocks the distal nerve ends, and it moreover also has an anti-inflammatory and antibacterial effect. This economical method provably reduces the side effects caused by opioids, such as nausea and vomiting, and it minimizes the duration of hospitalization and the occurrence of incision infections. As an optimized form of pain therapy, wound infiltration constitutes an essential component for fast-track rehabilitation. With InfiltraLong, Pajunk has developed a wound infiltration catheter which guarantees the undisturbed flow and the uniform distribution of the anesthetic. This ensures absolute freedom from pain along the complete length and depth of the incision. The construction of the catheter is unique. It has been provided with an array of micro-perforations arranged in a spiral line running along and around the catheter. Both the diameter and the spacing of the perforations are characterized by absolute regularity and utmost precision. We can therefore achieve a precise and uniform 360-degree distribution of the anesthetic. The beginning and the end of the perforation have been provided with markings to ensure that the perforated segment of the catheter can be placed in the incision along its complete length. The integrated stainless steel helical coil is visible under ultrasound, and it is also radi-opaque. It guarantees a constant flow of the anesthetic, and it protects the catheter optimally against buckling and creasing. And the kink protection at the hub of the catheter will furthermore ensure operational safety outside the incision. The catheter itself consists of transparent polyamide. If the catheter is misplaced, then the inflow of blood can be detected instantly. This permits an immediate reaction. With a diameter of 19 G, the InfiltraLong catheter is available in 5 different catheter and perforation lengths, providing the size suitable for every incision. The use of the InfiltraLong catheter is recommended particularly for long and deep incisions in the following surgical fields: in abdominal surgery, for the treatment of incisions under the ribs or for laparotomy, hernia operations, in gynecological surgery, for hysterectomy, caesarean section and breast surgery, in heart-thorax surgery, for heart and thorax interventions, in bone and joint surgery, for arthroscopy and spinal column surgery, as well as for iliac crest bone grafting. The catheter can be positioned in the incision either by means of a split cannula or a TUI cannula. The InfiltraLong set with split cannula consists of wound infiltration catheter, split cannula, filter, fixalong, and optional elastomer pump. The InfiltraLong set with TUI cannula consists of wound infiltration catheter, TUI cannula, filter, adapter, and fixalong. The application of InfiltraLong is demonstrated by an example of continuous pain treatment in the abdomen. The wound infiltration catheter is placed in pre-peritoneal position, that is, above the peritoneum. The aim is to ensure that the catheter does not injure any blood vessel. First, the catheter is removed from the container. Before application, the catheter is filled with saline solution and ventilated to check permeability. The formation of uniform droplets may be seen along the perforated segment. The split cannula is introduced through the skin by way of a separate access located within a maximum of 30 to 50 millimeters from the wound to be operated. When the tip is visible in the wound, then the lock can be loosened and the metal cannula is retracted. The catheter is introduced through the split cannula in such a way that the complete perforated segment comes to rest in the wound and the anesthetic will be released evenly. The split cannula is now separated and removed. Then the filter is connected to the catheter. An initial injection of approximately 10 milliliters of the anesthetic serves to verify the proper infusion. It initializes post-operative pain treatment. The catheter has to be secured by means of suturing material and applying multiple knots at the exit point. Then the wound is carefully closed. The catheter and the filter are secured in the vicinity of the catheter emergence using the fixalong. The patient will thus have the greatest possible freedom of movement. Optionally, the fixocath can be used as a combination of dressing and fixation. It is attached directly to the exit point so that buckling or creasing of the catheter can be excluded to the greatest possible extent. Pajunk offers a complete closed system consisting of the pump, well-bonded discharge lines, filter and InfiltraLong catheter. The InfiltraLong catheter should be carefully removed at the latest after 72 hours. The active infusion ensures that this will not cause any pain. The InfiltraLong catheter is the result of combining the decades of experience which Pajunk has acquired as a catheter manufacturer with the knowledge concerning the special requirements for pain treatment of large incisions. Its special characteristics guarantee absolute freedom from pain along the complete length and depth of the incision. You can find the complete range of Pajunk products at pajunk.com.